some sort of... Oh! Today we're reacting to some medical situations that occurred on a highly popular show, Family Guy. Not sure what Family Guy is? Well, it's an animated show on Fox that follows the Griffin family and tends to be pretty funny. According to the Fox website, Family Guy is also endearingly ignorant. Not sure what that means for the clips, but I'm excited to watch. I hear it's really hilarious. Before we get into it, I appreciate you watching my channel. My name is Dr. Jordan Wagner. I'm an ER doc that deals with every medical situation you can think of. Gunshot wounds, COVID, broken hips, firework mishaps. I created this channel to answer the medical questions I get from people every single day. If you find this video helpful, please smack the subscribe button and turn your bell notifications on. That way you learn when I post a new video. All right, ready to watch some funny medical clips? Let's react to Family Guy. Oh, some sort of... Oh! Man!
No, I'm not all right, my...
That's horrible.
You idiot!
Holy cow. Whatever he ran over and shot out of the lawnmower straight into Quagmire's head. Horrible. It's good at least that he's pushing pressure on it.
Take your hand away.
Oh, it's stuck in there. Ah! Okay, don't pull it out. Okay, don't pull it out. Make sure that you go to the hospital right away, because if you pull it out and you've severed something or you've punctured something and now you remove it, it could get even worse. Let a doctor remove it in a setting that an emergency then can be taken care of if it gets even worse.
Oh my God, a piece of your brain came out.
Oh my gosh, don't do that.
Maybe it's not so bad. I can feed it to my pet zombie.
Well, I guess brain is tasty to pet zombies, but that's horrible. Don't pull anything out that is impaled into your body. Go to the closest emergency department right away. Stabilize whatever is impaled in your body. So if it's this huge fence or a big stick, stabilize it so it's not bending all over the place as well. Moral of the story, do not pull any impaled object out of your body, even if your friends try to convince you. All right, number 2 clip.
Mrs. Griffin, it's a good thing you brought this child in.
Why? Is he okay?
I'm afraid he's very sick. In fact, his lab work shows he's suffering from Hodgkin's lymphoma.
Oh no.
Scotty has cancer?
I don't know, I didn't read the whole Wikipedia entry between the 80s.
Okay, hold on. Okay, we'll talk about Hodgkin's lymphoma in a moment. But when the doctor says he looked it up on Wikipedia, I think you want to turn and run the other direction. Wikipedia is not a medical source. Yes, we look things up on medical sites, not Wikipedia that anybody can add information to. That's horrible. Doctors never do this. Oh my gosh, he backed away and has a tip jar there. This is absurd and non-professional.
Well, do you have any idea how expensive medical school is?
No, I don't.
Well, it's probably pretty expensive.
Oh my gosh. Okay, let's break this down for a second. Hodgkin's lymphoma and non-Hodgkin's lymphoma has to do with a type of cancer relating to your lymph nodes. The white blood cells of your body are being made inappropriately, and in this type of cancer, you'd have different therapies that you do, radiation and chemotherapy. Most of them are treatable, and people do really well. But then this doctor goes into describing his medical school debt. Yes, after 12 years of education and schooling, doctors have a lot of student debt, but never in my career have I ever heard or seen of a doctor pulling out a tip jar. That's horrible. Let's check out video clip number 3.
My stomach! I think my hernia ruptured! Oh my God! It's bad.
A hernia ruptured. We get patients in the emergency department all the time that are worried that the hernia is going to rupture and burst. Typically the hernia won't rupture and burst. It'll actually get closed off and tightens, and we actually have to try to push this back in. And we actually end up putting it back in majority of the time in the ER by just deep, hard compression to that area, and eventually the body just sucks the intestines back into the abdomen.
No, she can't! Thanks to you, I don't have insurance anymore! What are we gonna do? I'll get the gun!
That's a real concern when people don't have insurance. They don't go to the emergency department for emergencies. Don't ever do that. Please come to the emergency department even if you don't have insurance or your unknown status of insurance, okay?
Just look it up on your phone or something! Ugh, hold on, I've got to update iOS. Okay, got it? It says I have to make an incision.
Oh my gosh.
How am I supposed to do that? Grab my tool belt.
Okay, do not perform home surgeries, okay? This is hilarious. But if it is incarcerated or strangulated, that's the hernia itself, that is actually when you do have emergency surgery that is performed by a surgeon, where they actually do the incision, they pull the intestines back through that hole, and then close that defect. Most of the time, they actually use a piece of mesh, and then they have to close back the skin. But let's check this out.
Sharpening linoleum blade. Ah! And then hold the incision open with a vice grip and use the slip joint pliers to get the muscle back in position. Okay.
Okay, this is pretty good. He's doing it without any anesthesia. I do not recommend that.
Now it's saying I have to suture it. I've got some monofilament line you can use. It's from aisle 8 above the chains and cables. Monofilament lines?
Actually, it's pretty impressive.
What to say, Brian?
Monofilament line, slip joint pliers, it's pretty impressive, right? Even Stewie says it's impressive. But monofilament line, like we use different types of nylon type materials or even dissolving materials that are different sizes like that. But we definitely use some sterile tools and sterile fields and all that stuff so we can prevent infections.
It seems like you really did learn something.
His bloody hand.
Yes, I did. But please, stitch me up. Just be careful and take your time. This is the delicate part because... Yeah, I'm gonna just use the staple gun.
Okay, the staple gun. We actually do use a medical stapler in the emergency department and sometimes during surgeries, but this one is hilarious. Pretty much, that was really good and pretty accurate. I just wouldn't do it in the home of the Family Guy setting. Obviously, we need a sterile field, but even more obviously, probably a child shouldn't be operating on their own dog. So hernias is when an organ pushes through an area that it shouldn't. Typically, the most common is like your intestines, where the small intestines pushes through and like your groin through the muscle wall and it's protruding out. Increases the risk of having an injury to that tissue by decreasing blood flow. So you need to put it back in. Otherwise, if it's left out too long, decreased blood flow causes ischemia or dead tissue to that area, and it needs to be operated on. All right, clip number 4.
Excuse me, I have
Looks like the pharmacy setting.
for 25 minutes.
Oh, I'm really sorry, Miss Dumont. We'll have that filled for you right away. Guys, what the hell's going on back there? Remember, each pill has to go into the correct bottle.
This ain't so hard.
Oh, Nelly. Okay. Oh. What? I don't think they're watching anything that they're doing. Okay. This scene takes place at a pharmacy. Sometimes pharmacies take a long time to process your medications. They have to count it out, make sure it's going in the right bottle, right label. In this setting, they're just getting random pills on a conveyor belt, going through different bottles and just putting in, and then they can't keep up, so instead they're just trying to eat it all. Bad idea. Could be mixing different types of medications that can have very serious consequences. It is not like this in a normal pharmacy. Things are set out appropriately, very sterile and clean, and they're counting them with specific devices and making sure that the label is matched up with the medication and the appropriate number so the patient gets exactly what is on the outside of the bottle. Let's check out video clip number 5.
Thank God. I really dodged a bullet there. I don't know what the hell I was thinking. Everybody makes mistakes. Even doctors.
Happens. Oh! I'm sorry for laughing. Wasn't expecting that. Yes, doctors make mistakes, but I've never seen a doctor blow up a patient. Typically, those are the paddles that we use for defibrillation and CPR, or when somebody's heart is in a funky rhythm that we need to shock it out of. It is very controlled, and the only thing that we really worry about is making sure the patient doesn't feel any pain and that nobody else is touching the patient, because if somebody's touching the patient or the bed, that electrical charge energy can actually be transferred to somebody who's still touching either the patient or the bed. But I've done this procedure many times and I've never had a patient explode on me yet. Hilarious. All right. Those clips were a little far-fetched, but for a comedic animated show, super funny and amusing to comment on. Great job to Seth MacFarlane and the rest of the team who created the show. Super entertaining, although not entirely medically accurate. Do you have a favorite show that features medical situations that you want me to react to? Let me know which show or episode in the comments below. And if you want to see me react to video games, check me out as an expert on gameology. I'll link to them below as well. And And as always, make sure you subscribe if you want to see more fun videos like this one. Alright, thank you so much for watching, and stay healthy, my friends.